Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys and experiences of experienced medical professionals. And today we have Dr. Monika with us. She's an experienced dentist and is now practicing as a cosmetologist in her own setup by the name Dr. Monika's Absolute Wellness Center, and she's here to discuss her journey, her experience. How did she pursue cosmetology? Why did she pursue that? What is the mindset a person should have while pursuing that, and henceforth? So welcome, Dr. Monika, to the platform. It's really nice to have you here.
Hello and a very good afternoon, everyone. I'm Dr. Monika. So just getting into a brief intro, I'm a dentist and a cosmetologist, and I'm practicing cosmetology in Noida. I have my own center by the name of Dr. Monika's Absolute Wellness. So if I come into what I did for cosmetology is FMC, Fellowship in Medical Cosmetology, from it's affiliated from Greifswald University, Germany, and IAAT, Sweden. So that's how I introduce myself.
Yes, it's very nice to know. And so understanding, because you were a practicing dentist, getting into cosmetology is a slightly different part. Yes, you study head and neck during your, dentistry days, but getting deep into cosmetic, what made you do that, and what was so exciting thing that you saw in it?
Actually, cosmetology is the next go for treatment and platform for everyone. Like it's a very hot and demanding thing in the market nowadays. Everyone wants to look beautiful, that we all know. And some treatments like, acne scars, as more of these are non-invasive treatments. So it doesn't require much of trainings and going any rigorous academics and all. It's a art of understanding. You need to understand the things, right product, right machinery, and right techniques is more of what cosmetology requires. So that's what I thought, and the raising demand in the market made me to opt it. It has larger ticket size, no doubt. Lasers, slimming, and injectables are new go-to thing in the trend nowadays, and will be the most hot seller thing in the market in the upcoming thing in the cosmetology. So that's how I looked into it and I opted for it.
That's very interesting to know. So what do you suggest all the current students and the doctors who want to pursue cosmetology? What kind of mindset should they have before getting into this branch? What do you suggest them?
It's like you don't have to do everything at a time. You can pick up from a single thing. Like you can start your setup with a mere investment of 25,000 if you want, and the higher side has no limit. You can put as much as machineries and brands you want to go for. You can start with peels itself. Peels are a most interesting and quicker result oriented procedure. The patient will immediately see the result in chemical peels. There are these various brands which you can go and opt for. Says Derma is there. It's a very renowned brand. Derma Quest and Akar is there. There are many peels. You have to understand the idea the patient is having, the type of skin he or she is having, and you can just select the peels according to the modalities, and the results are very quick in peels. So you can start with chemical peels. Here PRP, it is most widely known procedure, and more of that, it's a procedure where with which you can treat many things. It's a multifaceted procedure. So if you want to treat your some skin related issues, you can use PRP. Hair related issues, you can use PRP. It's just the thing. With a single machine, you can treat many modalities. So in PRP is to a good idea. So chemical peels along with PRPs and some medifacials collectively round about 25 to 50K, you can start these procedures and you can incorporate in your practice. And after that, you can consider switching to machines and all. So that's how the idea is. आपको बड़े scale पे जाने की जरूरत नहीं होती है. You can pick up these minor things, minor procedure, and you can just go for it.
That's very interesting to know. Ki always start small. if you are thinking to pick up cosmetology, just start small and then slowly proceed. But ma'am, कि जिस तरीके से आपने समझाया कि start small and आपको skin type पता होना जरूरी है, you mentioned. So is this skin type, because not many people understand skin type despite being a doctor, कि किस तरह का skin type है और क्या है. Is this something that is being taught during your course, and how do you understand that is what I want to know.
Because it's been taught in the training, like कुछ चीजें तो हमारी understanding की बात होती है, बाकी कुछ चीजें we get to know in the trainings, like if a patient is coming to you, you don't have to go into ailments. Dermat is there, they will do their job. If you want to see a beauty related aspect or beauty related concern, like people are having open pores किसी disease की वजह से नहीं होते. Open pore happens, and open pore is there present in everyone's skin, and they are there because of the products we use. So you have to understand what they are using, what they have used, and what you can offer them. So accordingly, you can make a plan, and you can always give the treatments in combination, because combination treatment yields best result. So understanding the skin type according to what you can see on the surface of the skin. You don't have to go on the subcutaneous level, dermis, epidermis. No, you don't have to go there. You just see what you are getting on the surface, and then accordingly you just decide the concentrations of the peels and which peel is suitable for that. So we can decide likewise. If acne scars are there, there are some different peels. So that's all we have been taught in the trainings, and we can practice that in our everyday usage.
This is nice to know. So now, ma'am, when you mentioned ki this is something that you do, and you are being trained, and you have been trained by Ilamed, are there any other institutes that you will suggest ki jahan se log training le sakte hain, and they can go forward with?
In fact, there are very renowned doctors who are getting these courses, conducted from many affiliated universities abroad. In fact, they are also giving opportunities. You can go out and you can practice for about a window of 1 month or something like that. So these international certifications are also based on that. I can name few, like Dr. Mridu Miglani in Delhi is there. She is also conducting few courses. Dr. Rajat Bhandari is there in Amritsar. He is also, procedures, these courses. In fact, KED is there, ILA KED is there. In fact, DY Patil is also conducting these, certification courses, and you can have these diploma and fellowships by opting for them, and they are quite convenient. You can opt it while practicing at your clinic. Like they have their online programs are also there, and some. You have to attend some hands-on programs. They are particularly based on the convenient time you will be giving to them. So accordingly, with mutual understanding with the doctors who are practicing the clinics, they can plan the batches, and it's very convenient. It's not like you have to shut off the clinic and go there. You can do it. So
that's very nice to know, because that helps you to get an extra skill to yourself. So now, when understanding ki you need to start, you can get trained and you need to start small and then progress. What is, apart from understanding ki what are the basic instruments you need to have? What is the basic manpower and the basic systems that you think should be in place to run the system smooth?
Manpower, if we talk about, if you want to start, everyone don't want to go up to that level. So if you are starting small, and of course that's a wise idea to start small, so you can just have a laser therapist who have the basic knowledge of these machines and all. There are many colleges who can provide you these therapists to conduct these type of courses with these professionals. So they just have to know how the machine is being used. They just have to understand about the technicalities of the machines. So have one laser therapist who can operate all, and more of, if you want to, like in preparing before and after the procedure, you need some beauty professionals. They'll do some massages and all. So I guess these two kind of people or assistants will be enough for you. The manpower aspect of things
to start with. Okay.
In that.
Okay. So is this that you need to have from the first day, or you expect ki just start forward, and then maybe when there's a flow you start?
You can start with your own also. Like if you want to start with a single chair, you can prepare the patient. you can use it just to enhance the procedure. I'm just telling you need these professionals. Otherwise, you can do it on your own also. There are products, just the right knowledge, right product and right knowledge of the procedure is what you are required. Just not damage the skin. You must know the idea and the duration of the procedure you are doing, the product you are applying. So that's it. Basically, the right product and right technique is what we require. More skillful professionals. These are very easy and non-invasive procedure. Just the right tactics is what we have to do in these procedures.
So now when you mention about manpower, what are the kind of, while running a setup of your own, I'm sure understanding about marketing and, putting the word forward into the market is also one very important part. Getting trained is one part, but cosmetology now, is something that everybody searches online. So what do you suggest with your marketing and how have you done it till now?
Yes. Marketing is a huge aspect in whatever business you are running in today's era. Marketing is something, if you are not a digital marketer, like we have seen many a times, then you are not a marketer at all. So looking up to marketing aspect, Practo is there because, of course, wherever the name doctor comes, Practo automatically comes. So register on Practo, you can purchase the slots of your particular area where you are practicing. So you will be forecasted more, your practice will be more forecasted, projected, and you will be getting the leads accordingly. And you have to concentrate more on the Google ads and Google ad campaigns. So Google ads is something which will significantly affect and benefit your practice. And the leads which are generated from Google, the patients which will come, they will also be the organic ones. So investing into Google, more than Practo, I'll say, investing into Google will be a wise idea. You just strengthen your Google profile. You put more of your procedures and practicing things on that. You just strengthen what you are showing there, your procedure, your results, your products. So all in all, I'll say you just strengthen your Google profile. So that's what.
That helps a lot, especially for local businesses. Yes. So now when you mention that this is a very strong way of marketing and, doing basic procedures. So what are the kinds of basic procedures that you go through every day for, just for a knowledge sake, for all those people who want to pursue cosmetology, what should they focus on in their training?
For basic procedure, if I talk about starting from medifacials, there are very basic medifacials. You just have to get through, like Hydra facial is very much popular these days. You can start with that. It's a very normal and a basic procedure anyone can do. And then you can do the procedure in combination. Rather going to the rigorous procedures in the first go, you should start with prepping the skin. Chemical peels you can start, as I have mentioned earlier, and then you can give a good medifacial, any of those according to the skin type and concern they are requiring. There are many, hydrofacial, photofacial, that you will get to know in your trainings and all. And you can start with lasers also if you want to start understanding laser. In laser, there are also many types of laser, ablative and non-ablative. That also you will get to know in your trainings. Ablative lasers, they are fractional and non-fractional again. Non-fractional lasers are Q-switch, and fractional lasers, if we talk about, that is CO2. So now maybe it's sounding like something alien thing to you, but you'll get to know when you will do the training and all. So you can start with a basic laser also, laser hair removal, diode laser is considered hair removal. Then you can slowly get into these fractional and non-fractional laser things. So what I want to say is you can start with chemical peel and medifacials, incorporating in combination technique, because combination always yield best results. And then you can go to the rigorous procedures. Like what we say, MNRF, microneedling is there, and going to injectables and everything. You can go. So that's how we can do.
So you say injectable is the new future.
Yes.
And this is something which is, if you can please elaborate.
Injectables is something everybody wants enhancement in their features. Nobody, if you know, if we talk about your nose is slightly lifted, we need that sharp nose. You need those plumpy lips. So nobody wants to go for those surgical procedures because that's something extensive. We
Hmm.
opt for surgeries when it's a dead end. And
Hmm.
the other surgeries, if somebody is going, he or she is conscious, surgery is the last option somebody wants to opt. These
Hmm.
injectables are very quick, almost painless. They just seem so barbaric, but they are very painless. And in fact, the formulations are there in the market with lidocaine, local anesthetic. So you don't even feel the pain while injecting. So if you want to cover these, minor enhancements you want to do in your patient, injectables are good to go, and they are safer even if you know the right technique. You are injecting with cannula and all. Needles are little risky, so learning the cannula technique is also being taught in the trainings.
Hmm.
So cannula is always the safe one and good to go. If you are opting for injectables in your lips, you can do the minor enhancement for your jawline, for your nose. If you want to do the cheek contouring and everything, injectables are a good hot topic and a go-to procedures for everyone who is not ready for surgery and these extensive procedures.
Hmm.
So, I-
No, this is interesting and nice to know how things are changing and how
yeah,
also what to focus on.
exactly, because the genre in which we are, of course, you and me, if we talk about,
Hmm.
we all want to look, maintained and lifted up. So we'll be investing more of into these procedures if
Correct.
we start ourselves ourselves. So
Hmm.
that's why I think cosmetology is going to uprise and uplift in the coming days, and injectables will be the hot field which we have to focus on.
Hmm.
Just right technique and right product is what we need to know,
Hmm.
and your injector should be skilled enough. Otherwise, there are many casualties also. So you need to focus on that part also, learning to how to deal with these emergencies. There are separate courses being run for these, so you can get to know from where you are enrolling yourself. They'll tell you everything.
Hmm. Hmm. So now when you mention, sorry. So
I'm telling we can mention the details in the interview, or
in the yes, yes, we can definitely do that.
from there where they want to do.
So now understanding ki how this is going forward and how things are changing with cosmetology also, what do you suggest for all those students and doctors who want to pursue right now and are confused ki karna chahiye nahi karna chahiye, what do you think and what do you want to advise them?
No, of course, one should go because it's a cherry on the top in which or what you are practicing, because it doesn't require much of your time. As I have mentioned earlier, you can go through the trainings while doing your clinical practices. In fact, there are flexible timings being run by various universities, and the courses which are being run by doctors and from the all those internationally affiliated universities. You should do it. Start slowly with a setup, smaller investments. You don't need to get on your nerves for those. Big things will take time. Of course, you can incorporate later on. But yes, you should start it because it's a good to go and cherry on the top, like I have mentioned just now.
Mhm.
So will be an addition in your practice.
So if you're so what Dr. Monika mentions, if you're thinking about it, just go for it. At least take a training because it's not something that you will take
Yes,
you have to take out time. Yes.
training is very mandatory. Training training solves many issues, many doubts you are facing. It will widen your knowledge regarding machineries and right product, which is a must to go through, and you will get the techniques also, because getting into training solves many things. Yes.
Correct. You're absolutely right. So now, lastly, I want to ask one thing. In our discussion, you mentioned that we need to focus on the beauty part of it, not the treatment. So treatment is for dermatologists, but when you are into the skin, and practice as a skin specialist, I'm sure there might be people coming up with some illnesses and some problems.
always refer to dermats are there. Why you want to go into that? That is our field of operation. So
That's true.
in fact, go and get a dermat, go associated with a dermat. But that's the thing we need to clarify. Cosmetology and dermatology are entirely different thing. We are dealing in beauty-related enhancement procedures, and dermats are dealing in ailments. Yes, do both, but we can just do these injectables and beauty-related procedures. So for all enhancements, beauty-related enhancement procedures, and all these lasers and PRPs, you can opt for a cosmetologist. So how we can do it.
Also, one more question. So this is a kind of a thing that many medicine allied branches are always confused that can we also do this course, or it is just for the medicine people and the dentists maybe who are doing that. Do you think all the other branches who are into Ayurveda, homeopathy,
medical backgrounds, they can do it? Like physiotherapists can also do it. Someone from the nursing background can also do it. Like the pharma people and all, they can also do it. Some of the procedures, not all the procedures, some of the procedures, some non-invasive like PRPs they can do, chemical peels they can do. Of course, injectable is little questionable because a dentist has a more of clear approach. Like we know how to inject local anesthetics and what all area of injectables on the face we have a better understanding in that. There are certain things it will be filtered for you. There will be some different diplomas which will be opting such kind of procedures and courses, offering such kind of procedures, so you can do that.
No, this is very nice to know and nice to understand how cosmetology is changing the picture entirely, and how is it coming up now big into the market, bringing up opportunities for everybody around. So as Dr. Monika mentioned, if you are interested and if you have this in mind, please at least go for training, understand how it is changing the scenario, and please take small steps towards it.
Yes.
So yes, sorry. Thank you, Dr. Monika, for coming here and being with us to understand how cosmetology is changing everything. It's actually very nice to understand it from you, especially now you are practicing it and have understood in this couple of years, how it is changing and how things are changing in this coming years.
Yes, of course. Thank you. Thank you so much, Ayushi, Dr. Ayushi, taking me for this platform and considering. So
yes, it is our pleasure, and it is our pleasure to have you here and understand what all works, what all does not work. So please do share this with your friends and colleagues. I'm sure cosmetology is something that is in the back of the mind of many doctors. Do share this with them, help them understand how it is changing, how the scenarios are changing, and if they want to pursue, they can actually do that. At least do a training for you to understand whether you really want to do this or not, and then picking up with small steps and then going further and doing, making larger things for yourself. So thank you so much, Dr. Monika. Thank you so much, everyone, for joining us today. I hope this discussion would have been helpful for you. Do follow us and do share this with everyone. Thank you so much, everyone. Bye-bye.